Have you ever walked out of a doctor's office feeling more worried than when you walked in, even though you felt perfectly fine before the appointment? Maybe you went in for a routine checkup. Maybe someone suggested, just to be safe, let's run a few tests. And suddenly, instead of reassurance, you're holding a report filled with unfamiliar terms, spots, shadows, numbers that seem just slightly off, and now you can't stop thinking about them. If that's ever happened to you, you're not alone. As we get older, especially after 60, we're told something over and over again. Stay on top of your health, catch problems early, don't miss anything. And that advice comes from a good place. Prevention matters. Being aware matters. But here's something that doesn't get talked about nearly enough. Sometimes, doing too many tests can actually create problems that were never there to begin with. And today, I want to have an honest, calm, and practical conversation with you about that. Not to scare you away from doctors, not to tell you to ignore your health, but to help you make smarter, more confident decisions about your body. We're going to talk about 4 very common medical tests that many older adults are encouraged to get. Tests that sound helpful, even responsible, but in certain situations can lead to more harm than good. And before we get into the first one, there's one idea I want you to understand, because once you see it, everything else will start to make sense. It's something doctors sometimes call a cascade, but you don't need a medical degree to understand it. Here's how it usually begins. You feel fine. You're living your life. Maybe you're walking regularly, spending time with your family, enjoying your routines. Then you go in for a test, not because something is wrong, but just to check. The test finds something small, not dangerous, not causing any symptoms, just something. But now that it's been found, it can't be ignored. So you're sent for another test. That leads to another. Maybe a specialist, maybe a procedure. And each step brings more waiting, more uncertainty, more anxiety. And in many cases, after weeks or even months, you find out it was nothing. It was never going to harm you. But by then, you've gone through stress, maybe invasive procedures, maybe side effects. And you don't feel better. You feel worse. That's the cascade. And the reason I'm sharing this with you is because many of the tests we're about to talk about can start that exact chain reaction, especially when they're done in people who feel healthy to begin with. So let's talk about the first one. And this one is becoming more and more popular, especially with all the advertisements you might see online or on TV. It's the full body scan, a full body MRI or CT scan. Now, I completely understand why this sounds appealing. The idea of checking everything inside your body all at once, catching anything early, having peace of mind. It sounds like the smartest thing you could possibly do for your health. You might think, why wouldn't I want to know if something's there? But here's what actually happens in real life. Let's say you're in your mid-60s. You feel good, no major symptoms. You decide to get a full-body scan just to be proactive. You go in, lie still for a while, and a few days later, you get your report. And somewhere in that report, there's a note. Maybe it says there's a tiny nodule in your lung, or a small cyst in your kidney, or a spot on your liver. Nothing urgent, nothing clearly dangerous. But it says something like, recommend follow-up. And just like that, everything changes. You didn't have any symptoms before. But now that little finding is all you can think about. Every sensation in your body suddenly feels suspicious. You start paying attention in a different way, not with awareness, but with worry. So you go back for another scan. Maybe it looks the same, maybe it's slightly different. No clear answers. Now you're referred to a specialist, and the specialist says, let's take a closer look. And that can lead to a biopsy or another procedure, something more invasive. And here's the part that surprises a lot of people. When researchers look at healthy adults over 60 who get these full-body scans, they find that the vast majority of them have something abnormal on the scan. In fact, it's incredibly common. These little findings are often just a normal part of aging. They've probably been there for years. They may never cause any problem at all, but once they're discovered, they set everything in motion. And what's even more important to understand is this. People who get these scans don't necessarily live longer. They don't avoid disease more effectively, but they do experience more anxiety, more follow-up tests, more procedures. So instead of gaining peace of mind, they often lose it. Now, this doesn't mean you should ignore your health. It doesn't mean imaging is never useful. These tools can be life-saving when used for the right reasons. But when you're feeling well and there's no specific concern, scanning everything just to look for something can sometimes do more harm than good. So what can you focus on instead? One of the most powerful ways to understand your health isn't by looking at a picture of your body. It's by paying attention to how your body actually functions. Can you walk comfortably without getting unusually short of breath? Can you get up from a chair without struggling? How's your balance, your sleep, your energy during the day? These things may seem simple, but they tell a much more meaningful story about your health than a scan filled with tiny, unclear findings. And having a doctor who takes the time to talk with you, really talk with you, about your daily life, your medications, your habits, that kind of care is often far more valuable than any machine. Because at the end of the day, the goal isn't to find every little imperfection inside your body. The goal is to live well, to stay independent, to feel confident in your body, not afraid of it. And sometimes that means being thoughtful about which tests you say yes to and which ones you don't. And that brings us to another situation that many older adults find themselves in, especially when it comes to memory. And that brings us to another situation that many older adults find themselves in, especially when it comes to memory. Have you ever walked into a room and suddenly forgotten why you went there? Or maybe you've had a moment where a name just wouldn't come to you, even though you knew it? If you have, I want you to take a breath for a second because what I'm about to say might ease your mind. That kind of forgetfulness is incredibly common. It's part of normal aging. It happens to almost everyone at some point, and in most cases, it's not a sign of anything serious. But here's where things can start to go off track. Sometimes, out of concern or love, family members encourage you to get it checked out. Maybe someone mentions Alzheimer's. Maybe you've seen stories online, and before you know it, you're sitting in a doctor's office being referred for a brain MRI. It sounds reasonable, right? If something might be wrong, why not take a picture of the brain and find out? But here's the problem. A brain MRI for mild, everyday memory slips often doesn't give you the answers you're hoping for. And in many cases, it creates more confusion and anxiety than clarity. Let me explain what tends to happen. You go in for the scan. A few days later, you're reviewing the results. And the report includes terms like mild atrophy, age-related changes, white matter lesions, or small vessel disease. Now, if you're not familiar with medical language, those words can sound alarming. They sound like something is wrong, like your brain is deteriorating. But here's the truth that doesn't always get explained clearly. For someone in their 60s, 70s, or beyond, those findings are often completely normal. They're not necessarily signs of disease, they're signs of a brain that has lived, learned, and aged, just like the rest of your body. It's a little like looking at your skin and seeing wrinkles or age spots. You wouldn't panic about that because you understand it's a natural part of getting older. The brain is no different. The challenge is that when those findings are written in medical language, they don't feel normal. They feel threatening, and suddenly you may start to see yourself differently. You might begin to worry about every small lapse in memory. You might think something serious is just around the corner, even if your day-to-day thinking is perfectly fine. And here's something that might surprise you. When doctors scan the brains of healthy adults over 70 or 75, the majority of them, often more than 90%, show these kinds of abnormal findings on imaging. But most of those people are living independently. They're reading, managing their finances, having conversations, enjoying life. In other words, the scan doesn't always match reality. I've seen people with scans that look concerning on paper, but who are sharp, engaged, and fully capable. And I've seen the opposite. People with real cognitive challenges whose scans don't look particularly alarming. So the picture alone doesn't tell the whole story. And when we rely too heavily on that picture, we risk creating fear where none is needed. So what's a better approach if you're concerned about your memory? Instead of jumping straight to imaging, it often makes more sense to start with something much simpler and much more meaningful: a basic cognitive assessment. These are short, practical tests that can be done right in a doctor's office. You might be asked to remember a few words and repeat them later. You might draw a clock and set a specific time. You might do a bit of counting or simple problem solving. They don't take long, but they give a clear picture of how your brain is actually functioning in real life. And if those tests show something worth looking into, then we take the next step. Because here's another important piece of the puzzle. Many causes of memory problems in older adults are not permanent. They can be treated or even reversed. Sometimes it's a medication that's making you feel foggy. Sometimes it's low levels of a vitamin like B12. Sometimes it's poor sleep or even depression, which can show up as forgetfulness. In other words, the issue might not be your brain structure at all. It might be something affecting how your brain is working, and that's a very different situation. When we focus on function first, we have a much better chance of finding solutions that actually improve your daily life. Now, to be clear, there are situations where a brain scan is absolutely appropriate. If someone is getting lost in familiar places, struggling to manage their finances, or showing clear signs of decline that are getting worse over time, then imaging becomes an important tool. But for the kind of occasional forgetfulness that comes with normal aging, jumping straight to an MRI can lead you right back into that cascade we talked about earlier. More tests, more questions, more worry, and often no real benefit. So once again, it comes back to being thoughtful, being informed, and understanding that more testing doesn't always mean better care. Now, there's another test that many people are encouraged to get simply because of their age, and it has to do with the heart. You might have heard of it, or maybe you've even been asked to do one already. It's the cardiac stress test. Now, on the surface, this test makes a lot of sense. Heart disease is common as we get older. We've all heard stories of people having heart attacks without warning. So the idea of checking how your heart performs under stress seems like a smart, responsible thing to do. You might be told, you're over 70, let's just run a stress test to be safe. Or maybe it's required before a routine surgery. And even if you feel completely fine, you might think, well, it can't hurt to check. But this is one of those situations where the intention is good, yet the outcome isn't always helpful. Let's walk through a very common scenario. Imagine you're in your early 70s. You stay active. You walk regularly, maybe even a couple of miles at a time. You don't have chest pain. You're not unusually short of breath. Overall, you feel pretty good. Then you go in for a procedure, maybe something like a knee replacement or a minor surgery, and you're told that because of your age, you need a stress test first. So you agree. You get on a treadmill. Your heart rate goes up. You do your best. And afterward, the results come back a little abnormal. Now here's the issue. In older adults, stress tests often produce what we call false positives. That means the test suggests there might be a problem, even when there isn't one. There are many reasons for this. Your heart rate might not increase the same way it did when you were younger. Medications can affect the results. Even normal age-related changes can make the test look concerning. But once that result is labeled abnormal, the next step is almost always more testing. And this is where that cascade begins again. You're referred for a more detailed procedure. Often that means a cardiac catheterization. A thin tube is inserted into an artery and guided all the way to your heart to look at your blood vessels from the inside. Now, this is not a small thing. It's invasive. It carries risks, bleeding, complications, discomfort, and emotionally, it can be overwhelming. And then, after all of that, the doctor might tell you, yes, there's some narrowing, some plaque, but nothing severe, nothing that requires a stent or surgery. In other words, what they found is exactly what we would expect in a healthy person in their 70s. But by that point, something has changed. You've been through a stressful experience. You've been told there's something in your heart, even if it's not dangerous. And now, you may start to see yourself differently. Maybe you hesitate before going on your usual walk. Maybe you stop pushing yourself physically. Maybe you think, I have heart disease now, even if your condition doesn't actually limit you. And just like that, a test that was meant to protect your health has quietly taken away some of your confidence and your freedom. So what's the better way to think about your heart? One of the simplest and most powerful tools you have is your own daily life. If you can walk at a steady pace, climb stairs, carry groceries, or do your normal activities without chest discomfort, unusual shortness of breath, or dizziness, your heart is already telling you something important. It's telling you that it's doing its job. Your daily activity is, in many ways, a real-world stress test. Now, if you do start to notice symptoms, chest tightness when you exert yourself, shortness of breath that's new or worsening, lightheadedness, those are signals that should absolutely be evaluated. That's when a stress test can be very helpful. But when the test is done simply because of your age, without symptoms, it often adds more confusion than clarity. And if the goal is to understand your future risk, there are other tools that can give more useful information without pushing you into unnecessary procedures. For example, there's a type of scan called a coronary calcium score. It's quick, non-invasive, and it measures how much calcium has built up in your arteries over time. Instead of triggering a chain reaction of procedures, it gives you a clearer picture of your risk and helps guide decisions about lifestyle or medication. It informs rather than alarms. And that's a key difference, because the goal isn't just to find something. The goal is to help you live better, with more confidence and less fear. And that brings us to the last test I want to talk about. This one might be the most surprising of all, because for many years, it's been considered one of the most important screening tools we have. It's the colonoscopy. Now, let me say this clearly, because it matters. Colonoscopy is a powerful, life-saving test when used at the right time. For people in their 50s, 60s, and even early 70s, it plays a major role in preventing colon cancer. It allows doctors to find and remove polyps before they ever turn into something dangerous. But like everything in medicine, the balance between benefit and risk changes as we get older. And after about age 75, that balance starts to shift. Here's why. The main benefit of a colonoscopy is preventing a cancer that usually takes many years, often 5 to 10 years, to grow and become a serious problem. So the question becomes, will that benefit still matter 10 years from now? At the same time, the risks of the procedure increase with age. The preparation alone can be tough. Drinking that solution, spending hours in the bathroom, becoming dehydrated or weak, it can take a toll, especially on an older body. Then there's the sedation, which can affect breathing or lead to confusion afterward. And there's one risk that doctors take very seriously: a tear in the wall of the colon. As we age, the tissue becomes thinner and more fragile. The chance of a complication like this increases, and if it happens, it often requires emergency surgery. And for someone in their late 70s or 80s, that kind of surgery can have a lasting impact on independence and quality of life. So when you put it all together, for many people over 75 who have had normal screenings in the past and don't have specific risk factors, continuing routine colonoscopies may offer very little benefit while exposing them to greater risk. That doesn't mean ignoring your health, it means shifting your focus. Instead of routine invasive screening, attention moves to something much more practical and just as important: listening to your body. Changes in bowel habits that don't go away, blood in the stool, unexplained weight loss, ongoing abdominal discomfort. These are the signals that matter. And if they appear, age doesn't matter. You get checked. At the same time, there are everyday choices that support your colon health in powerful ways, without any risk at all. Simple things like eating more fiber, fruits, vegetables, beans, whole grains can help maintain a healthy digestive system and reduce the risk of problems over time. It's not complicated, but it's effective. And when you step back and look at all 4 of these tests together, a pattern starts to emerge. It's not that the tests themselves are bad, it's that when they're used without a clear reason, when they're driven by fear or habit or age alone, they can start a chain of events that takes you further away from the life you want to live. Because real health isn't about chasing perfect test results. It's about being able to wake up in the morning, move your body, think clearly, connect with people you care about, and feel at ease in your own life. And sometimes protecting that kind of health means knowing when to say yes to a test and when to pause, ask questions, and make a different choice. Remember, you are not just a set of numbers on a report. You are a whole person with experiences, goals, and a life that deserves to be lived fully. So the next time someone recommends a test, take a moment. Ask why. Ask what it will change. Ask what happens next. Because the more you understand, the more confident you become. And confidence, especially in your health, is one of the most powerful things you can have as you move forward.